Hi, good afternoon or good morning. My name is Dr. Jason Amstutz, and I'm a chiropractor here in Southern California, sports related mostly. I'm also a student of traditional osteopathy, and I have an upcoming presentation in Long Beach for the CCA Sports Symposium in Long Beach, California in May of 2024. So if you're taking a look at this, I hope to see you there. And I appreciate you going through the next 4 minutes of explanation about how the adjustment and osteoarticular pumping are both synergistic, complementary, different in some ways, etc. I'm Dr. Jason Amstutz. I'm a chiropractor from LACC as of 2006. I'm a Soma therapist in the Guy Voyer osteopathy program. I'm also a Soma trainer. I'm a student of osteopathy, hoping to finish my diploma of osteopathy, a traditional osteopath. And I'm also a teacher of a program here in the United States called the Soma Therapy Program, as well as some of my own courses. So one of the biggest questions that I get from athletes, students, patients is, why pumping? Why are you doing all this pumping, doc? Why are you not just adjusting me? Why are you doing all this pumping, doc? Why am I not just doing exercise, etc.? And this is part of my answer. The proper fluid that's present in the joint, which is the extracellular matrix as well, the lymphatics, all of which plays a pivotal part in proper biomechanics and performance. So you've got to have the fluid to have proper biomechanics, and that's a small part of tensegrity, which is a combination of compression and tension. The tension comes from the strings or the fascia, the ligament, the tendon, etc., aponeurosis. But the other part that it has to stay in balance with is the fluid that's in the same system, partly in the ligament, in the extracellular matrix, again in the lymphatic canals and other fluids of the body. The basics for pumping, for osteoarticular pumping, are creating space to allow for flow of the fluids, doing a change of the volume, which changes the pressure minutely up and down, which helps move fluid, whether it changes the state of the fluid or it actually moves fluid, creating flow. And then the micro movement, this one here, improves the macro movement, and that's where we talk about how I'm going to be presenting on the upper limb. So it's the micro movement and the slide ability of the scapula, let's say in relationship with the clavicle. We call it the clitoscapular pinch. Open and closing the pinch through protraction and retraction is really what drives a lot of the movement of the fluid, but also allows for proper biomechanics of the whole upper limb. Chiropractic adjustment, we have our goals depending on what type of chiropractor you are: normalizing the mobility of the bone of the segment, reducing compression or tension to a nerve root, causing a big neurologic impulse, all of which are part of the chiropractic paradigm. Osteoarticular pumping, what are the goals? Mobility of the fluids within the joint capsule, to change it thixotropically, to normalize the capsule itself. That's where a lot of the information comes from. The deep ligaments, same thing. That's where a lot of the information to the brain comes from. Balancing the fluid and the tensions to free the joint. And the difference between them is a couple things. One of them is restoring the fluidity to the capsule and the deep ligaments and the tissues. Addresses a lot of the chronicity that's incorrect in an injury related to the structural change, not just moving the bone. Although moving the bone is super important and still is a part of what we do. By normalizing all the above, you improve the neurological portion that's been affected in each and every injury. There's always a neurologic component or compromise in every injury: ankle sprain, UCL injury of the elbow, etc. Because the insult that happens to the fascia changes the afferents from the whole system. The synergy between them, I would argue that pumping is a more comprehensive way to change the system because you affect the fascia, the resting muscle tone, the neurologics, the fluid, the tensions. And the adjustment is often still needed, but it's to disengage or to rotate or to gain some of the micro movement in these complex motion segments.